Okay, welcome back, everyone. We are still on osteology. In a previous video, we looked at the clavicle and we looked at the scapula. Now we're moving down the upper extremity to the arm. The other term for arm is the humerus. So let's take a look at some of these structures on the humerus. How do we know we're looking at the humerus from the anterior view or from the posterior view, right? If we look here, anterior surface on the left, posterior surface on the right. When we go all the way down to the bottom, all the way down to the inferior end or the distal end of the humerus, on the anterior side, there's two fossas. On the posterior side, there's one fossa, and it's a pretty large and it's right in the center. So if we see one depression on the back, we know it's on the posterior surface. If we see two depressions at the distal end of the humerus, the two fossas are on the anterior side. Okay, so that's right off the bat. The other way is that we look for this groove or this sulcus or this depression right here. This depression we only see, or this groove, we only see on the anterior. We don't see that sulcus or groove on the posterior. So this depression or this groove is called the intertubercular groove, aka bicipital groove. They're both acceptable answers. Intertubercular, the reason why it's called intertubercular is this bump here is the greater tubercle, and this one here is the lesser tubercle. So between the greater tubercle and lesser tubercle is the intertubercular groove. But what travels in this intertubercular groove, aka bicipital groove, is the long head of the biceps. The long head of the biceps brachii travels right through this, this valley, if you would, this groove. So we also call it the bicipital groove. So again, we have the greater tubercle, lesser tubercle, and intertubercular groove. The greater tubercle right here is the attachment site for 3 of the 4 rotator cuff muscles. The rotator cuff muscles we call sits, S-I-T-S, S-I-T-S, sits. The S is for supraspinatus. The I is for infraspinatus. The T is for teres minor, teres minor. Those 3 rotator cuff muscles insert right here on the greater tubercle. So SIT, supraspinatus, infraspinatus, and teres minor all insert right there on the greater tubercle. The last rotator cuff muscle, we said they were 4, sits, S-I-T-S. That last S is for the subscapularis. Remember, we said the subscapularis originates on the subscapular fossa. So right there on the lesser tubercle is where the subscapularis inserts. And this is important, knowing these attachment sites, because when patients say, oh, my shoulder hurts, I have so much pain, and they point to exactly where it is, if they're pointing more on the outside, we're thinking maybe supraspinatus, infraspinatus, or teres minor. If they're pointing more to the inner part, we're thinking maybe subscapularis. Okay. All right. So again, important landmarks because there's muscles that attach there to all 3 structures. Here is the head of the humerus. Here is the head. And then there's the anatomical neck, just distal to it, the anatomical neck. And then here's the surgical neck. Why is it called the surgical neck? It's the surgical neck because that's where most surgeries are taking place if there's fractures right here at the surgical neck. Okay, on the posterior view, you can see the head of the humerus really, really nice. And you can see the greater tubercle on the lateral side, on the outside. Okay, you can't see the lesser tubercle from the posterior view because it's more anterior. You can see it here really well. All right, when we go down about midway, there is a little bump around the midway mark called the deltoid tuberosity. And what do you think? What muscle do you think is going to insert on the deltoid tuberosity? The deltoid muscle. Okay, so the deltoid tuberosity is an important landmark where the deltoid muscle inserts. From here to here, this is just the shaft of the humerus, or the diaphysis, if you would, of the humerus. Now let's look at what's happening at the distal end. Okay. At the distal end, I said that there were two depressions on the anterior surface and one depression on the posterior. They're all fossas. On the lateral side is the radial fossa, and that's because that's a depression for the radius to attach to. And on the medial side is the coronoid fossa. Now, how does it get these names, coronoid fossa and radial fossa? To understand that, I'm just going to skip ahead to right here, where we're looking at the radius and ulnar bone, which is the forearm. Okay, so if we look at on the right-hand side, the anterior view, the proximal part of the radius is called the head of the radius. And then we have a proximal part of the ulna called the coronoid process. So the head of the radius, or the radial head, and the coronoid process, these two landmarks are going to articulate here and here, the radial fossa and coronoid fossa, when the elbow bends. So when your elbow bends, elbow, these two landmarks are going to fit perfectly in these two depressions. Okay. On the posterior side, there's the Olecranon Fossa. How does the Olecranon Fossa get its name? Well, remember, this is on the posterior surface of the humerus. If we look at the posterior surface here of the ulna, the proximal part of it is called the olecranon, or olecranon process. This is the part of your elbow when you're leaning on a desk or leaning on a table. This is the bony part that we call the elbow, that kind of, bangs up against the desk or that you're leaning on. So this olecranon fossa fits perfectly in the olecranon fossa. The olecranon process fits in the olecranon process when the elbow is fully extended. When the elbow is extended, the olecranon process fits right here in the olecranon fossa. But when the elbow is flexed, the head of the radius and coronoid process fit in their corresponding fossas. And the capitulum right here, this rounded portion called the capitulum, fits perfectly here with the head of the radius. This head of the radius articulates here. This is concave, and this is a little bit convex. So it's a perfect fit. Then this part, the trochlea, which means like spool, spool of thread, right? This spool, like a spool of thread, called the trochlea, is going to articulate beautifully with the trochlear notch. So this really perfect depression called the trochlear notch, this is going to articulate perfectly with the trochlea of the humerus. So this junction here and this junction here are going to articulate beautifully to form the elbow joint. Okay. And there's only two other landmarks that are important of the elbow. There's the medial epicondyle, which is much more prominent than the lateral epicondyle. The medial epicondyle is a very important attachment site for your finger flexors and your wrist flexors. In fact, if you put your hand right over the medial epicondyle and just go a little bit distal to it, there's a lot of muscle here, and then you pump your fist, you can see how the muscles contract. Whether you pump your fingers this way, you'll get movement right here, or if you flex your wrist, you get a lot of movement here. That's because those flexors attach right to the medial epicondyle, right here. And if you put your hand on the opposite side, where the lateral epicondyle is, and you extend your wrist and extend your fingers, you'll feel movement on the lateral side of the forearm. So all of your wrist extensors attach here, and all of your wrist and finger flexors attach here. Okay. Okay, let's pause here.